Welcome to our Week 12 lecture on integrating treatment for co-occurring disorders. So first, let's start with a definition of what a co-occurring disorder is. They are defined as the existence in an individual of at least one independent major mental disorder, as well as an independent addiction and related disorder. So it's when you're seeing a mental health diagnosis as well as a substance use disorder diagnosis. You may also hear the term dual diagnosis, and so that's also the same thing that we're referring to when we talk about co-occurring disorders. So a little bit of statistics about how often and how much this is occurring. So it's been estimated that 37% of alcohol abusers and 53% of persons abusing other substances have at least one serious mental illness. It's also estimated that about 50% of individuals with severe mental disorders are affected by substance abuse. And of all people diagnosed as mentally ill, about 29 to 34% had a problem with either alcohol or other drugs. Here's just a little more statistics put into a graphic from SAMHSA. And so they state here that 8.9 million Americans are living with a co-occurring disorder. So that definitely is a big section of our population. However, you can see as well that only about 7.5% of those 8.9 million enroll in a treatment program. So there definitely is a need for integrated treatment for co-occurring disorders. And so when we look at co-occurring disorders in drug treatment centers, this information comes from SAMHSA in 2012. They looked at 1.3 million substance abuse admissions that year, so 1.3 million people entering treatment for substance abuse. And of those million, 1/3 were diagnosed with another mental disorder. And then the numbers on the right indicate that of those that had a substance use disorder as well as a mental health disorder, 35.1% of those were abusing one drug, 35.2% of those were abusing two drugs, and 29.3% were abusing 3 or more drugs. So it's important to make a distinction between pre-existing and substance-induced mental illnesses. So a pre-existing mental illness is when a person has a clearly defined mental illness and then becomes involved with drugs. And obviously we know that often those substances that are being used can be used as a coping mechanism for that individual. The second, though, is a substance-induced mental illness, and so this occurs when an individual develops a psychiatric problem as a result of their substance abuse or withdrawal from those substances. So in these cases, what's happening is that the way that the drug is affecting the brain's chemistry is creating a chemical imbalance that may often be temporary, and with withdrawing from the substance, that mental illness can disappear. And so this is something that you might see with cases such as delirium, dementia, persisting amnesic disorder, psychotic disorder, mood disorder, anxiety disorder, sexual dysfunction, sleep disorder, and hallucinogen persisting perception disorder. So the overall idea here is that when we think of co-occurring disorders, we should recognize that there's kind of two ways it can come about. Either there's a pre-existing mental illness, or there's something about the substance that's being used that's creating and influencing the mental illness. And then another way to conceptualize this is using a 4-quadrant model. And what this does is this acknowledges that for individuals with a co-occurring disorder, the severity of either the mental disorder or the substance use disorder or both may be at different levels. So you can look at quadrant 1 in the bottom left, where that individual would be experiencing a less severe mental disorder with a less severe substance abuse disorder. If you move to quadrant 2, people in that category would be experiencing a more severe mental disorder with a less severe substance abuse disorder. Quadrant 3 is a less severe mental disorder with a more severe substance abuse disorder. And then quadrant 4 is a more severe mental disorder with a more severe substance abuse disorder. So this recognizes that there's going to be different levels of severity for the mental disorder and or the substance abuse disorder. So with some individuals, one may be more or less severe than the other. With some, both of those are going to be really severe, and with others, they may not be as severe. So it's just kind of a way to recognize that there's going to be a variety of severity and impairment that people are experiencing around these co-occurring disorders. So next we're going to move into talking about integrating treatment. So there's some different ways that we can conceptualize treatment models for substance abuse and mental health. So first there's the single model of treatment. So this is when only substance abuse or only mental health is being addressed by the treatment agency. So they're only providing services for one or the other. Then there's also the sequential model of treatment. And so this is when, for example, substance abuse is treated at the agency and then clients are referred to a mental health agency afterwards. And that can work vice versa as well. Then there's the parallel model of treatment, where simultaneously someone is being treated in an agency for substance abuse and also being treated in a different agency for mental health. So they're often going to be at different locations or at least a different provider that's providing that service. And then the next level would be the integrated model of treatment, and this is what we're going to be looking at. This is kind of the gold standard for treating co-occurring disorders, because we do know that there is a benefit when we have treatment of both the substance abuse and the mental health occurring at the same time and also at the same location and by the same care providers or team of providers. And so that's when that treatment can really work best. And so that doesn't necessarily mean that these other ways of treating parallel or sequential may not, it's not saying that they're not effective, but it's being shown that the most effective way to treat a co-occurring disorder is through this integrated model. So with co-occurring disorders, you need co-occurring treatment, and that's the idea behind integrating treatment. So I'm going to post a link on our Canvas page to this video. It's about 20 minutes or so long, but I would invite you to watch that. It talks about, it follows one agency and discusses how they were able to integrate treatment into their program for co-occurring disorders. And so it provides an interesting look at that process. So that link will be posted on our Canvas page, or if you download the PowerPoint, the link is in the notes section below. So of course the importance of having integrated treatment is to increase access to treatment. So sometimes before integrated treatment was really being thought about, you would have situations where someone would seek assistance for dealing with substance abuse, but they would also have this ongoing psychiatric illness. And so addiction treatment programs maybe were telling people, hey, we can't accept you because since you do also have a psychiatric illness, that's kind of above our scope of practice. That's not something we have the capacity to deal with. And so in order for you to be able to come into our program to treat your addiction, we need you first to get some more support around your mental health diagnosis. But of course, that kind of puts people in this strange cycle of now they're seeking help for their mental health and psychiatric illness, but they have this underlying substance abuse issue as well. and they may be denied access to mental health programs that are saying, well, we don't have the capacity or the scope of practice to deal with this ongoing substance abuse as well. And so it's kind of the idea that these two agencies are kind of working separately and not acknowledging how these illnesses and disorders are integrated, and so they're asking people to get them kind of separately treated, but there's not any overall bringing together of treatment in one place where those both can be addressed. And so obviously this is the goal of integrated treatment, that we are treating substance abuse and mental health at the same time. So an important concept with integrated treatment is the concept of no wrong door. And this idea is that effective systems must ensure that an individual needing treatment will be identified and assessed and will receive treatment, either directly or through appropriate referral, no matter where he or she enters the realm of services. So the goal is that the overall healthcare delivery system can work in a way so that people can access treatment at any point that they come into contact with service providers. So a client with a co-occurring disorder needing treatment might enter the service system through a primary healthcare doctor or a homeless shelter or a social service agency, or through the ER at the hospital or in a criminal justice setting. Either way, whoever they're first in contact, they can make referrals, or if they have the capacity to provide treatment at those locations for those co-occurring disorders, both addiction and mental health. So whereas before, when we talked about how people might have been told, well, you have a substance abuse order, but we can't help you with your mental health disorder, you need to get that treated first, go figure that out. This is the idea that you can enter at any point, and we're going to help make those referrals, we're going to help provide that treatment, no matter where you're entering our system or what diagnoses you have going on. So there's 5 major implications for this. So these are things that service agencies need to be taking into account. And the first is that assessment, referral, and treatment planning for all settings must be consistent with a no wrong door policy. Second is that creative outreach strategies may be needed to encourage some people to engage in treatment. Third is that programs and staff may need to change expectations and program requirements to engage reluctant and unmotivated clients. Fourth is that treatment plans should be based on the client's needs and should respond to changes as they progress through stages of treatment. And fifth is that the overall system of care needs to be seamless, providing continuity of care across service systems. This can only be achieved through an established pattern of interagency cooperation or a clear willingness to attain that cooperation. And so this is a good vision of a fully integrated treatment for a co-occurring disorder. So these would kind of be things that an agency that's looking to switch to an integrated treatment model would be looking to implement in their program. So the first is that the client participates in one program that provides treatment for both disorders. Also, the client's mental and substance use disorders are treated by the same clinicians. Those clinicians are trained in psychopathology, assessment, and treatment strategies for both mental and substance use disorders. The clinicians offer substance abuse treatments tailored for clients who have severe mental disorders. The focus is on preventing anxiety rather than breaking through denial. Emphasis is placed on trust, understanding, and learning. Treatment is characterized by a slow pace and a long-term perspective. Providers offer stage-wise and motivational counseling. Supportive clinicians are readily available. 12-step groups are available to those who choose to participate and can benefit from participation. And neuroleptics and other pharmacotherapies are indicated according to clients' psychiatric and other medical needs. So these are all kind of signs or goals for a fully integrated treatment program for co-occurring disorders. So that concludes the first part of our lecture. Next will be part 2, understanding mental health. So we'll take a look kind of at some basics of understanding mental health and mental health disorders. So look for that on our Canvas page.